Good morning, student. Today we are going to learn about the general feature of the pubis and general feature of the ischium. So hip bone is an irregular bone and it is formed by the fusion of the three bone, superiorly ilium, antero-inferiorly pubis and postero-inferiorly ischium. These three bones join to each other at a hollow-shaped cavity called acetabulum. So this is acetabulum where these three bones joins to each other. Now this pubis and the ischium, they are separated by one large opening. This large opening is known as a obturator foramina. Now let us see what are the general features over the pubis. Now pubis is placed antero-inferiorly and it is forming the anterior margin of the obturator foramina. It will form 1/5 portion of the acetabulum. Pubis has a body, so this is body of the pubis, and it has a two ramus, superior ramus and the inferior ramus. Now what are the features over the body? This body is flattened from before backward. It has a total three surfaces: anterior surface, posterior surface and the medial surface. Anterior surface is directed downward and forward. Anterior surface is directed downward and forward. Posterior surface is directed upward and backward. And this medial surface, also known as a symphysial surface, which is directed medially. And if we join opposite side of the hip bone, it will form the symphysis. That's why this medial surface also known as a symphysial surface, and it will form the secondary cartilaginous joint. This anterior surface is roughened over the supromedial area and rest of the surface are the smooth. Posterior surface, also known as a pelvic surface, because it is forming the anterior wall of the true pelvis and it is related with the urinary bladder. Now this body has one border known as a superior border or pubic crest. This pubic crest is extending from the symphysis to the one elevation known as a pubic tubercle. So this is superior border, or you can say the pubic crest. So this is superior border of pubic crest. Now let us see the superior ramus. This superior ramus is extending from the pubis to the obturator foramina. Superior ramus has three borders, three surfaces. One is superior border. Superior border is extending from the pubic tubercle to the iliopubic eminence. This elevation is known as a iliopubic eminence, which is representing the fusion between the ilium bone and the pubis bone. So this superior border extending from the pubic tubercle to the iliopubic eminence. It is also known as a pectineal line or pecten pubis. Now one is anterior border. So this anterior border is extending from the pubic tubercle up to the acetabular notch. This is notch of the acetabulum. So from the pubic tubercle up to the acetabular notch. This border is like a rounded ridge shape. This border is also known as the obturator crest. So this is the anterior border, or you can say obturator crest. Now inferior border. This is inferior border of the superior ramus, which is forming the upper margin of the obturator foramina. This is obturator foramina, so this is inferior border forming the upper margin of the obturator foramina. Now three surfaces. We have discussed about the border. Now what are the surfaces? So between the superior border You can see this superior border is like a ridge. So between the superior border and the anterior border, this surface is known as a pectineal surface. This is somewhat triangular in shape. So this is pectineal surface. It is also extending from the pubic tubercle up to the iliopubic eminence. Now another surface is between the superior border and the inferior border. So you can see this is the pelvic surface of the superior ramus because it is continuous, it is representing or related with the true pelvis, and it will continue with the pelvic surface of the body of the pubis. And another surface you can say is the inferior surface, which is extending between the anterior border and the inferior border. This is inferior surface, or you can say obturator surface, because it is forming the obturator groove. So this is obturator groove. So again enumerate the borders and surfaces. This is superior border or pectineal border, or you can say pecten pubis. Anterior border also known as obturator crest, and this is inferior border. Between superior and inferior there is presence of pelvic surface. Between superior and anterior there is presence of pectineal surface, and between the anterior border and inferior border there is presence of the obturator surface. This is all about the superior ramus. Now this is inferior ramus. Inferior ramus is forming the medial margin of the obturator foramina, and it will continues with the ramus of the ischium. This is ischium. This is ramus of the ischium. So this inferior ramus continues with the ramus of the ischium, and then it will form the conjoined ischiopubic ramus. So this is conjoined ischiopubic ramus. So this is all about the inferior ramus. So we have completed the general feature of the pubis. Now let's see the general feature of the ischium. Now let's see the general feature about the ischium. Ischium is placed postero-inferiorly, and it will form the posterior margin of the obturator foramina. It will form 2/5 portion of the acetabulum. Now what are the features of the ischium? So ischium has a two end, upper end and lower end. Upper end is represented by the 2/5 portion of the acetabulum, and its lower end represented by the ischial tuberosity. This is ischial tuberosity, which is presenting the lower end, and upper end is represented by its 2/5 portion of the acetabulum. This lower end continues as a ramus of the ischium, and it will join with the inferior ramus of the pubis and form the conjoined ischiopubic ramus. So it has a two end, upper end and lower end. It has a 3 borders and 3 surfaces. Now let's see what are the borders. One is anterior border. So this is anterior border of the ischium. Anterior border of the ischium is representing the posterior margin of the obturator foramina. Then again, one border is posterior border. This is posterior border of ischium. It will continue above with the posterior border of the ilium. So this posterior border of the ischium, it will form the lower margin of the greater sciatic foramina. So this is greater sciatic foramina, and its upper margin is formed by the ilium, and lower margin is formed by the posterior border of the ischium. Then it will project and form the one spine known as the ischial spine. Then this posterior border ended over the upper end of the ischium. So this is posterior border of the ischium. Now lateral border. This lateral border of the ischium is representing the lateral margin of the ischial tuberosity. This is ischial tuberosity. So its lateral margin is represented by the lateral border of the ischium. Now what are the surfaces? Now this lateral border, I have forgot that this lateral border is in upper side, it will represented by one notch. So this is notch, and then it will continue as a lateral margin of the ischial tuberosity. Now what are the surfaces? One is pelvic surface. It is between the anterior border and the posterior border. This pelvic surface is from the lateral wall of the pelvis. And one is dorsal surface. Dorsal surface is continuous above with the gluteal surface of the ilium. And then it will form the convex surface of the acetabulum. So it will represent by the convex portion of the acetabulum. And then it will present one notch. After that, it is continuous as a dorsal surface of the ischial tuberosity. So ischial tuberosity also represented in the dorsal surface of the ischium. Ischial tuberosity divided by one transverse ridge into the upper area and lower area. And again this transverse ridge divided into the upper area and lower area. Upper area again divided by one oblique ridge into the superolateral area and infromedial area. And this lower area again divided by one longitudinal ridge into the outer area and inner area. This is all about the dorsal surface. So we have completed this pelvic surface and this dorsal surface. Another surface is femoral surface. This femoral surface is between the anterior border and the lateral border. And this femoral surface is continuous above bounded by the acetabulum and behind bounded by the ischial tuberosity. So this is all about the borders of the ischium and all about the surfaces of the ischium. Now let's see what are the features over the acetabulum. So we have already known there is a hollow cup-shaped depression. It is hemispheric in shape. It has a two part, non-articulate part and articulate part. Non-articular part is also known as the acetabular fossa. This is acetabular fossa, in which there is a presence of fat and it is covered with the synovial membrane. Articular part is shaped like a horseshoe shape. It will lined by the hyaline cartilage. And the margin of the acetabulum is related with the acetabulum labrum. Below this acetabulum is represented by one notch known as the acetabular notch. So this is acetabular notch. This is articular part of the acetabulum, or this is acetabular fossa, which is non-articular part of acetabulum. This acetabulum will join with the head of the femur and it will form the hip joint. Now what is obturator foramina? This obturator foramina is oval shaped gap between the pubis and the ischium. Anterior margin of it is represented by the pubis, posterior margin represented by the ischium. This oval shaped gap is different in male and female. So you can differentiate between male and female hip bones by seeing this obturator foramina. So in the male, obturator foramina is larger and oval in shape. In the female, it is a smaller and triangular in shape. This obturator foramina is covered by a obturator membrane except over the upper portion, which is known as a obturator groove, from where there is a passing of the obturator vessels and nerves. So we have completed the general feature of the pubis and general feature of the ischium. Thank you.